So if you're suffering with neck pain, there's really three areas you have to address if we're going to get it corrected, both in the short and long term. That's the alignment of your spine, the integrity of the disc, and the state of the soft tissue. And we do all three at Advanced Health. So let's go over exactly what we should look for in a healthy neck and people that essentially can function without neck pain. And I want to start with the alignment of your spine, okay? Your spine, particularly in your cervical curve, it's critically important to have a 42-degree curve. What that does, it carries the weight of our head. On average, our heads are around 12 to 15 pounds into the back of the joint, hence that's why we have all this extra bone back here. It allows the soft tissue to work with the normal limits, and it places a nice healthy load into the discs. However, many people with neck pain and suffer with neck pain, it's usually from an environmental standpoint that causes that neck pain. And what we see a lot of in our office is people who sit for a living. The average American sits for 9+ hours a day. So when we sit all day, what happens is, over time, due to everything being in front of us, our curve in our neck becomes decreased. This creates a big issue within our spine in three ways. First thing that happens is it puts massive amount of stress and tension on all the structures, muscles, ligaments, tendons that anchor your neck into your upper back and down into your shoulders. Obviously, when those muscle ligaments and tendons are under stress and tension, then obviously you're going to get some neck pain. The second thing that happens is you start to put really unhealthy load into the joint. For every inch our head shifts forwards, you add an extra 10 to 15 pounds of pressure. So if your head shifted forward 2 to 3 inches, that's up to 30 to 45 pounds of extra pressure you're putting through the front of the spine. Again, we're not designed to carry weight at the front, it has to be carried at the back. So this is where we start seeing damage within the disc, and this is what we really specialise in at Advanced Health, is the integrity of the disc and restoring it. So unfortunately, once you lose your disc health, it's gone. So let's talk about those discs. When you evaluate a disc, it should look like something like this, like a jelly donut essentially. Now remember, discs are like brake pads in your car. So imagine this in here is the jelly in a donut, and it's protected by this fibrous collagenous tissue around the outside. It's kind of the bread of the donut. And when you have good posture, the disc's nice and plump, and there's a lot of room for the nerve to come out of. However, when you lose that head posture, or that forward head posture, for example, when you lose that neck curve and you stretch out that neck, then all the load sits at the front of the disc, and again, it's not designed to carry weight like that. So, over time, the disc becomes damaged, and what we see is the disc starts to narrow, and then the collagenous tissue around the outside here starts kind of getting brittle, and this fluid starts becoming more viscous, and it starts to want to kind of go places because of the pressure. And over time, what happens is that disc then cracks the kind of bread of the donut. It's like pushing on that jelly donut and the jelly coming out of it. And it seeps onto the back of this nerve here. And when the nerve's impinged, and that's when we start getting neck pain, or any pain that's going to travel, into your shoulders, hands, fingers. And what happens is, over time, that disc degeneration leaves less room for the nerve to come out of, and that gives us less wiggle room to essentially move and function. So what are typical treatment methods? Well, usually, you're going to do your NSAIDs, non-steroidal anti-inflammatory drugs, over-the-counter meds, Aleve, Tylenol, ibuprofen. And they're okay, you're going to take the edge off the pain and address the symptoms, but then you're addressing the symptoms and not the root cause. Second portion of treatment is usually going to be PT and or, you're going to be recommended for surgery depending on how damaged that disc is. For me, surgery is an absolute last resort. It's there when you need it. So try all the conservative care before we get there. And that's exactly what we do at Advanced Health. Predominantly, we focus on the alignment of your spine. And through cutting edge techniques, we can actually objectively change the shape of your spine and bring that curve back in. Okay, and that does two things. It creates better alignment in your spine, better load into the disc, and essentially you can rehydrate and replenish that disc. And the last thing we do is we focus on the soft tissue through lots of physical therapy. We're really 360 degrees of wellness in this office. You're going to have chiropractic work, lots of traction, and lots of physical therapy. And by doing those exercises combined, those therapies combined, we get great results. So if you're sitting there with neck pain, or you have a family member, a co-worker, a friend that's suffering with neck pain, do a quick check. See if their ears in line with their shoulder. However, if their ear's out in front of their shoulder, then we've probably lost a lot of that cervical curve. And if you lost a lot of that cervical, it really needs to be examined by a professional, specifically a chiropractor. So if you're suffering with neck pain and or family member, co-worker, friend that suffers with neck pain, share this video with them, tag them in it. Hopefully we get some value and we'll see you on the next one.